Orthostatic hypotension, or postural hypotension, is a form of low blood pressure that happens when standing after sitting or lying down. When blood pressure gets too low, this can cause dizziness or lightheadedness, and possibly even fainting. Dizziness and lightheadedness are the most common symptoms, but confusion, weakness, and blurry vision may also occur. Orthostatic hypotension is more common in older individuals. We think this may be due to baroreceptor sensitivities. These baroreceptors help control blood pressure in different situations. Other causes of orthostatic hypotension are severe volume depletion and medications. Let's start with baroreceptors. If these are not functioning properly, an inadequate amount of norepinephrine is released, which causes the body to not be able to compensate for the pooling of blood in the lower extremities when standing. Some conditions that can cause this to happen are Parkinson's disease, Lewy body dementia, and multiple system atrophy. Peripheral neuropathies may also cause the baroreceptors to fail. Diabetes is the most common cause of peripheral neuropathy, but there are many other conditions that may cause it. The second cause of orthostatic hypotension is volume depletion. This can be caused by bleeding, vomiting, hyperglycemia, or diuretic medications. And finally, many medications can cause orthostatic hypotension. Some examples are diuretics that I just mentioned, other blood pressure medications, antidepressants, opiates, phosphodiesterase 5 inhibitors such as Viagra, and alpha-1 blockers. Orthostatic hypotension is diagnosed by checking blood pressures while sitting and then checking it again while standing. We normally consider a 20 millimeter of mercury or more drop in systolic or a 10 millimeter per mercury drop in diastolic blood pressure as postural hypotension. It is important to treat this condition because orthostatic hypotension greatly increases fall risk. When patients fall, they may hit their heads or break bones. So how do we treat this condition? First, instruct patients to stay well hydrated and stand up slowly from a lying or sitting position. Drinking water is especially important before getting out of bed the first thing in the morning. Increasing salt intake may also be beneficial to help keep the blood volume stable. Either eat salty foods or use salt tablets. I have posted an Amazon link to salt tablets in the description field of this video for your convenience. It is also important to avoid being in hot temperatures and or hot showers or saunas if you suffer from postural hypotension. These may increase vasodilation, which lowers blood pressure. Cardiac exercise can also help, as poor cardiovascular conditioning makes orthostatic hypotension worse. Compression stockings can help decrease blood pooling in the extremities. What about medications? Well, we have 2 FDA-approved medications currently for orthostatic hypotension: droxidopa and midodrine. The first drug we use, though, if symptoms initially improve with increased salt and water intake, is fludrocortisone. Fludrocortisone has 2 main effects. As a mineralocorticoid, like aldosterone, fludrocortisone initially increases blood volume by causing the body to retain sodium. This effect requires several days to weeks to reach its peak. Fludrocortisone also increases peripheral vascular resistance by enhancing the pressor response to norepinephrine. Peripheral extracellular fluid accumulation, or edema, also limits blood pooling. If fludrocortisone is ineffective, we next check plasma norepinephrine levels. If this level is less than 200 picograms per mil, we use midodrine. And if it is above 220 picograms per mil, we use a norepinephrine transport inhibitor, such as atomoxetine. In practice, I see a lot of midodrine being used. Midodrine acts as a vasoconstrictor of the arterioles and other vessels, which increases peripheral vascular resistance and also increases venous return. It is especially useful for orthostatic hypotension because it has minimal cardiac and CNS effects. What about side effects of these three drugs? First of all, fludrocortisone is contraindicated in those with systemic fungal infections. Like all steroids, it has a long list of side effects. Just a few examples are muscle weakness, impaired wound healing, headache, vertigo, and irregular periods in females. Midodrine has several contraindications, such as urinary retention, severe heart disease, pheochromocytoma, thyrotoxicosis, and excessive persistent supine hypertension. Side effects include itching, shivering, tingling sensations, and problems with urination. Atomoxetine is contraindicated within 2 weeks of taking a monoamine oxidase inhibitor. It's also contraindicated in narrow-angle glaucoma, pheochromocytoma, or in severe cardiac or vascular disorders. Atomoxetine has a long list of side effects, including abdominal pain, nausea, vomiting, diarrhea, dizziness, headache, insomnia, and others. If you often feel dizzy or black out when you stand up quickly, you just might want to be checked for postural hypotension. Remember, the first steps are increased salt and fluid intake. Also remember to get up from a lying or sitting position slowly. Exercise is important to strengthen your heart. If you have any questions about this topic or any other health and wellness topic, feel free to email me at michael.brown@sunshinentc.com. If you know anyone who would benefit from this video, please forward it to them. If you have enjoyed this video, please give it a thumbs up and subscribe to my channel for more happy, healthy living content. I'm Pharmacist Michael. Be happy and be healthy.